Dr. Sajid here again. Parents often ask me questions about speech in children. When does it develop, and when does a child start speaking properly? So let's talk about it. We're going to discuss the development of speech, when it occurs, and how, and when does a child start making sentences. And if he does not speak, what are the possible causes, and when is it that you should then get to the doctor, in which situations? So to begin with, hearing is a very important part of speech, and so a child has to hear to be able to speak. And the hearing depends so much on the ears, for example, the outer ear, and then the sound from the outer ear gets into the middle ear through this tube, and it hits the eardrum or the tympanic membrane, and the sound makes it vibrate. And then there is an apparatus for hearing, which is in the inner ear, and then from there it is transmitted to the brain through the hearing nerve. And in the brain, there is a capability of understanding or deciphering what this sound is, and understanding what this sound means. So this is very important. And now a child can hear right at birth, but does not have speech. The only form of communication at that time is crying, which may be considered a form of speech. Whether the child is crying because of pain or discomfort or hunger or lack of sleep, too many clothes, too little clothes, too warm, too cold, that is sometimes, actually all the time, for the mother to decipher, and she does a pretty good job. But the baby, of course, hears right away and starts recognizing by about 3 months of age, and soon thereafter, if you call the child, then he or she will turn towards the sound and of course give a smile, certainly between 4 to 6 months. By 6 to 9 months, the baby starts making a few sounds. Babbling may not be very clear or very distinct, but does make sounds and experiments with it. And between 7 months to a year, besides the hearing, has some understanding of some words that you call out to him with. And then about 1 year to 1.5 years, they start making words, and single words initially, and then by 1.5 to 2 years, at least 2 words together, and then the vocabulary goes up to about 50 words, and by 2 to 3 years, of course, they certainly should be able to start making sentences. And by 2 years, most people can understand at least half of what they're saying, and by 3 years, maybe 75% of what they're saying. And certainly by the time a child is 4 years of age, anybody can understand what the child is, so can communicate properly. So how do you know if, and what happens that a child may not be able to speak proper? One, of course, is there may be problem with hearing, so that is most crucial. Then there might be difficulty with the tongue, maybe a tongue tie, maybe muscles of the tongue or the jaw in the mouth, that the baby is incapable of making sounds. And then, of course, it is quite possible that all of this is all right, but the brain does not understand the sound, or cannot decipher it, it cannot understand what it means. Of course, that implies that there may be something gone wrong, unfortunately, with the brain or with the hearing center in the brain. So in which situations should you be worried? If your baby does not follow you when you speak with him, or even before that, if a baby does not startle with loud sounds, because he should be able to hear and therefore should show some response. A little later, if you call the baby and the baby doesn't turn towards the sound, and or if the baby is not producing any word, not even a single word, a little beyond a year, maybe a year and a half, and if the child does not start making sentences, or at least putting 2 to 3 words together by 2 years, then you should worry about it. So what basically you need to know is, does he hear, and if he hears, does he understand, and does he make you understand? So these are things that you need to make a note of, and then you need to tell your doctor, because he has to find out whether the problem is in the ear or in the muscles, as I said, or whether there is a more significant problem with the development, unfortunately maybe, of the brain. And lastly, the matter of spending too much time with television, iPhone, or iPad, unfortunately takes the child away from hearing normal sounds, from normal communication, and sometimes that delays the speech also. So I hope that what I have explained to you has been of some help, and that you'll keep an eye on your child and make sure that the child's hearing and speech development is going according to his age. Of course, you need to continue communicating with him that you should have started right at birth. That makes things a little easier for him to acquire speech in the first 2 to 3 years of life.